Well, it is your one-stop shop for all of your skincare needs. I'm here in our town, Mattoon, at VitalSkin Dermatology. Physician assistant Jennifer Slater hanging out with us. Thank you for having us.
Thank you for coming. We're glad you're here.
Well, and this is a beautiful space here in our town, Mattoon. It hasn't been here all that long.
We opened in December of 2020, and we are certainly glad to be here.
Well, and this is a very developed area. It's starting to grow, so this is a great space for you guys here. We checked you out in our town, Decatur, learned a little bit about your services there. So let's talk a little bit about what you have to offer here in Mattoon.
Sure. We are a medical and surgical practice. We also offer some cosmetic services as well, and we are certainly a one-stop shop.
Okay, well, we're going to go check out exactly what a procedure and what a visit would look like if you have those type of concerns.
Sure.
So let's go check it out.
Okay.
All right, so we've made our way back now to one of your procedure rooms.
Yes.
Let's talk a little bit about when is the right time to schedule an appointment to get your skin checked.
Sure. Well, there's no wrong time, but if you're having a problem, a mole that's changing or growing, something that's bleeding, or a sore that won't heal, those are reasons to come in right away.
Okay, and so now we are here. We're here for a skin check. Let's kind of walk through what that visit and what that appointment looks like.
Sure. Typically, we have a patient change into a gown. They undress to their level of comfort, and then I use a special instrument called a dermatoscope, which is just a flashlight with a magnifying lens on it, to examine their spots. And we start on the back. We work all around, head to toe, and look at their skin.
Okay, let's talk what you're specifically looking for.
So, I am looking for certain things that you can only see under the magnification, changes or the network of pigment in a mole, and some other things that we can identify with their dermatoscope.
Yeah, because something like to my eye that might look just like a freckle or a mole may actually be something more serious.
Correct. And with my naked eye, the same thing. I may not be able to tell. But when I magnify by 10, I'm able to see the color, the shape, the pigment network, lots of different things, blood vessels, and that helps me identify what is worrisome and what is not. If it's worrisome, then we may talk about doing a biopsy.
Okay, yeah, let's talk about treatment options.
Sure.
So maybe you have found something maybe a little concerning, maybe you've got some questions about. What does that process look like?
So we typically, after we get the patient's permission, we numb up that area that we're concerned about. And typically, after it's numb, we just shave off a little piece of skin that gets sent to the pathologist. The pathologist looks at it under the microscope. They send a report back to us. We interpret that report and then make a decision as to the best method of treatment. Sometimes there's no treatment required. Sometimes if it's a wart or something minor, we can freeze it with liquid nitrogen. Other times we may need to do a surgical procedure on it. And we do that here in the office.
Yeah, and you have a doctor here on staff, Dr. Yaus. So if you have maybe something you want him to consult on, he'll be the one that does all of the procedures, yes?
Dr. Yaus does the procedures, and I do consult with him. Sometimes I'll have him come in to see the patient if I have a question about something. Other times we just review labs or pathology results, and he actually does the surgical procedures.
Well, wonderful. Just one of your many great locations here in our town, Mattoon, at VitalSkin Dermatology. We appreciate you having us.
Thank you for
Skin
coming.
looks great. If you have any questions and maybe you need a skin check here now that summer is here, we will definitely connect you with everything happening at VitalSkin Dermatology at CILiving.tv.